I am Felicia Skelton. I am a staff physician at the Houston VA, the Michael E. DeBakey VA Medical Center, an assistant professor at Baylor College of Medicine, and I am so excited to talk to y'all about one of my passions, um, and something that's been really meaningful to me over the past couple of years, which is developing self-compassion through taking care of people with disabilities. So, even before the COVID-19 pandemic, my life imploded in 2020. As part of the grieving and then healing process, I developed a keen sense of awareness of areas of my mental health that needed, well, rehabilitation. I had the equivalent of an emotional overuse injury, having long neglected my own needs in pursuit of my clinical and then research training. The most important revelation turned out that I was max A in self compassion, like really, really bad at it. I was really, really good at being compassionate towards other people, not so great at being compassionate towards myself. So, like I said, 2020 was a dumpster fire. But my professional life was essentially the only thing that was going right in my life. And so I decided to explore what I could learn from these relationships, especially the relationships that I had with some of my patients. And then I started to think about previous relationships that I'd had all throughout my medical training, just trying to say, okay, what lessons can I learn from this? And this is what I found. So the first lesson is never crush hope. And for the love of God, don't use percentages. As it is often with the intrepid, I learned this lesson the hard way. Um, I, I remember being a bright and shiny PGY2 at the University of Washington, and I was seeing one of my first rehab patients, and it was a younger man that had a new spinal cord injury. A new complete spinal cord injury. So I was so excited. I had done my Asia exam. I did everything that I was supposed to do. And saw that he was a complete spinal cord injury, a complete tetraplegic spinal cord injury. And of course, he asked, will I ever walk again? And again, me being the bright and shiny PGY2 that I was, I knew, my prognosis stats backwards and forwards. And I told him, well, there's probably a 10% chance that you'll be able to walk again. And for the next 3 months, I heard him talk to me about this 10% chance that I had quoted to him that he was now quoting back to me. Um, Sometimes he was happy about it. Sometimes he was miserable about it. Sometimes he was like, well, why the heck would you tell me that I have a 10? And I realized that that was probably not the most useful way to kind of talk about prognosis with a young man who had just had this catastrophic illness. Um, so there's one of the things that I realized early on in my career, and it's building towards compassion and then self-compassion, is you can never crush hope. There's a lot of wrong ways to have difficult conversations. Um, but the one way that you can do it right is to never crush hope and to lead with love and to lead with compassion. And don't use numbers for the love of God. So lesson 2 is that all Hemis walk. And I learned this one from my program director, Terry Masagli at the University of Washington. And what I took from this is that you have to trust in your knowledge and trust in your capabilities. So hemiplegia after stroke, if you have one good side, one good leg with assisted devices, there should be some sort of ambulation possible. It may not be far, it may not be pretty, but it'll happen. And so, what this taught me is that even during the dark times, even when things look kind of fuzzy, you have to trust in your own abilities. And something that a lot of women in color, struggle with is imposter syndrome. And so sometimes when I'm going through one of those phases, and I'm going through like, well, I don't know if I'm good enough. I don't know if I should be here. I can't tell you how many rooms I've walked into where I'm the only person who looks like me in that room. I take a deep breath, say, all Hemis walk, and I tell myself I'm supposed to be there. Um, so I'm starting to learn a little bit more. I'm starting to kind of really get a hold of this self-compassion thing. So lesson 3 is to know thyself and to thine own self be true. And this is really about self-awareness. You have to understand your values and what's important to you. And then a step further from that is what makes you uncomfortable. You can't have difficult conversations. You can't have uncomfortable conversations if you're uncomfortable and you're not even aware of where you're uncomfortable. And now you're awkward and fumbling and doing all sorts of weird stuff. Like that's not going to work out in rehab or in life. And so for the trainees in the audience, be really familiar with the parts of disability that make you uncomfortable. Sometimes it's, really severe spinal cord injury or traumatic brain injury or something about um, a patient's condition kind of just gets under your skin a little bit. Instead of trying to turn a blind eye to that and ignore that because I'm so busy, I'm so doing the other things, really start to say, okay, well, why does that make me feel that way? Because I promise you, there's something that you can learn about yourself and you can learn about um, your growth and what matters to you from that uncomfortableness. So get comfortable, get really, really comfortable with being uncomfortable. The sooner you can do that, the better. So lesson 4 is unlike in baseball, there is crying in rehab. There's lots of crying. There's shouting. There's screaming. Um, and I think we've all seen this. We've seen that patient that is mad at the world, angry, acting out, being quote unquote difficult, being quote unquote non-compliant. It's what I learned after a lot of reflection and a lot of time and kind of seeing this mirror back in my own life is that they're acting out this loss of control. And their way to do that, the way to get that back is a way of trying to regain some control. And I think we all do that. If we're honest with ourselves, we all do that in some way or another. And so giving yourself permission to feel that way, giving yourself to be that non-compliant patient in the eyes or the perception of other people, if that's what you're feeling at that moment and that's kind of what you need to do and what you need to process is really, really helpful and not something I think we speak to a lot or give space to a lot. And something that's been really helpful to me is the whole idea that suffering equals resistance times pain. We can't always change the painful things that happen to us, but if we don't resist, so if resistance goes down to 0, and y'all can check my math because that was not my strong suit, the suffering goes away. Something to think about. So last but not least, put your own oxygen mask on before helping others. How many people knew that they were going to miss hearing that on a plane when 2020 started? And what I took from this is that it's really about setting healthy boundaries. It's really about saying no when you mean no, saying yes when you mean yes, and being okay with that. We do it with our patients, but we don't do it with ourselves. We give everything to our patients, we give everything to our families, we give everything to our colleagues, everything to our trainees, but you have to leave something left for yourself. Um, so these are a little bit of my stories and a little bit of the wisdom that I've gained along the way. I'd love to talk with you about it. If anything resonated with you, I'd love to hear about it. Um, but if not, just thank you so much for the time.